Advent Health Multi-Specialty Office at Winthrop with bariatric surgeon Dr. Venkat and endocrinologist Dr. Kannan. Thanks for having me out here.
Our pleasure.
So I understand that you guys are husband and wife. How do you bring your specialties together to help people on their weight loss journey?
I'm going to go first with that. So we try to provide a comprehensive whole person approach to this complex disease of weight struggle that we call obesity. As an endocrinologist, this disease is always baffling to me because of the interplay of hormones. So when the person comes in with the weight struggle, I try to evaluate them, understand their disease, and come up with treatment options that are different from person to person. And as a bariatric surgeon, he tries to help out with the things that I cannot do, being a medical specialist. So I channelize patients that way, but our communication is both ways. So if people have already had surgery and the disease relapses, or they don't qualify for surgery, but they've stepped into his door first, he sends them my way.
That's great. So there's like a synergy going on. Dr. Venkat, what are some common misconceptions that people have about bariatric surgery?
First of all, when they hear about the word surgery, everybody is kind of taken back, and do I need to have surgery? I'm okay, and things like that. To me, I always look at things like this, right? It's not about weight in pounds, it's about what goes with the weight, right? So a lot of times when someone is overweight, they not only have overweight issue, but also they have issues like diabetes, high blood pressure, high cholesterol, sleep apnea, acid reflux, joint problems, so on and so forth, right? I can list so many things that go with the weight. So it's not just weight, it's a lot of things that go with it. That's why we say it's a metabolic problem. And it's a complex disease process which cannot be handled with one approach. So when the weight goes beyond a certain limit, we say one approach alone is not going to help them in the long run. So it's not just surgical approach, it's not just non-surgical approach. When the weight goes beyond a certain limit, we say it has to be combined, both surgical and non-surgical approach, and that's where it, both of us working together in tandem helps them in the long run.
And I think that's going to, be comforting to people to know that there are different options and that you guys work together. If somebody's watching right now and they want to go on a weight loss journey, what should they do?
I would first reinforce that this is a disease, so they need to seek medical attention so that we can understand their disease. It is unique from person to person. Their struggles are unique. Their treatment options are going to be very unique compared to even their siblings or their friends that they've known of. So the first thing is seek attention, please. There's help available whether you qualify for surgery or not, whether you qualify for medications or not. So that's one. And the second thing is don't be afraid. There's a lot of help, and we take a team approach, and we have a lot of support.
Yeah, I really do like the part of this whole team approach, and it must mean a lot to both of you to be able to help people on their weight loss journey.
Absolutely, absolutely. Weight loss journey usually starts with non-surgical approach. And of course, when the weight, like I said, goes beyond a certain limit, we go with the number called BMI, which is body mass index, which is calculated based on someone's height and their weight. And the normal BMI is 19 to 25. So anytime BMI goes beyond 25, that's when we say overweight. And anytime BMI goes beyond 30, that's when we say obesity. So when someone has overweight issue of 25 to 30, then non-surgical approach alone is enough for them to address their weight needs. But when the BMI goes beyond 30 and 35, that's when we talk about the combined non-surgical and surgical approach. And I always tell my patients, just because I do surgery doesn't mean it's done there. It's actually starting there, and that has to be combined with the non-surgical side of it for them to maintain their weight loss journey for a long term.
Thank you both so much for inviting me out today and sharing this valuable information with our viewers.
Thank you for the opportunity.
Our pleasure.